Good afternoon, everyone. My name is Supapitch Subenja, and today I'll be presenting an intriguing case of a rare vascular anomaly, a suprasellar cavernous malformation, which in this case primarily presented with progressive memory loss. So this report will highlight the challenges of diagnosing and managing such lesions, given their rarity and proximity to critical neuroanatomical structures. For the background, the cavernous malformation, or CM, in short, are vascular anomalies accounting for less than 1% of all cases when located in suprasellar region. The lesions are often found in the optic chiasm, pituitary stalk, and hypothalamus, causing the visual disturbances and endocrine dysfunction. However, the memory impairment as a primary symptoms, like in our case, is rare. Let me walk you through the case. So this patient is a 58-year-old woman with underlying diabetes mellitus, presented to the hospital with 1-year history of progressive memory loss. Her symptoms included forgetfulness, difficulty recalling, and repetitive behaviors. A cognitive assessment revealed a significant deficits. With the Montreal Cognitive Assessment scores or MoCA of 18 and the recall memory score of 0. Importantly, her visual and endocrine functions were normal. The MRI shows a lesion of a 2.5 centimeters lobulated suprasellar lesion with a mixed intensities and hemosiderin deposition, consistent with a cavernous malformation. So this lesion exerted a mass effect on the optic apparatus and hypothalamus. The patient underwent the endoscopic endonasal transsphenoidal surgery with pituitary transposition, achieving the complete resection, and the pathology confirmed the diagnosis of cavernous malformations. Her postoperative recovery was uneventful, with the transient diabetes insipidus resolving within a week with no visual or hormonal deficits. However, her cognitive improvement was partial, with her MoCA score improving only to 24. Now let's discuss the broader implications of this case. The suprasellar cavernous malformations are exceedingly rare, accounting for less than 1% of all cavernous malformations. The location near the critical structures poses significant challenges for diagnosis and management. While the visual disturbances and headaches are common presentations, this case stands out due to the unusual symptoms of progressive memory loss, which occurs only in 13% of all CM cases. The memory impairment in such cases is often linked to the mass effect on the mammary bodies and phonesis, disrupting the papillary circuit. The MRI findings of this case support the mechanism. The imaging also illustrates the diagnosis difficulty in distinguishing the cavernous malformation from other suprasellar lesions, such as craniopharyngiomas, meningiomas, emphasizing the need for early imaging in the patients with cognitive decline. Further surgical resection remains the cornerstone of treatment. While most cases require craniotomy, the transsphenoidal approach is effective, like shown in our case. Although the total resection often resolves the symptoms like headaches and visual deficits, the memory impairment is less likely to fully recover, particularly when the key memory structures are involved. To conclude, this case highlights the importance of considering suprasellar cavernous malformation in this patient with cognitive symptoms and suprasellar lesion. Early diagnosis and tailored surgical approaches, like the endoscopic transsphenoidal route, are essential for optimizing outcome. However, as seen here, the memory recovery may remain incomplete despite the successful resection, underscoring the need for timely intervention to minimize the long-term deficits. Thank you.
Now you have 3 minutes for questions and answer session.
Could you explain us a little bit more about why this patient have transient diabetes insipidus after operation?
So, yeah.
The DI
Oh, yeah,
after
sure.
surgery.
So the diabetes insipidus is a common postoperative complications after the transprenatal and especially the endoscopic route, because it will just alter like the pituitary glands, and then it may be like reversible injured during the procedure.